Chicago's CARE program, a new approach to mental health crisis calls. Chicago's mental health crisis response is facing a critical juncture as the city grapples with the efficacy of its CARE program, a cornerstone of its efforts to address growing mental health struggles. But here's where it gets controversial. Despite promises of a more compassionate approach, the program's success hinges on a delicate balance between compassion and accountability, leaving many questioning whether it's truly delivering the care needed. In a chilly October 2023 afternoon, a single mother on Chicago's North Side watched her teenage daughter erupt in rage, screaming and threatening to take her own life. The girl, once vibrant and socially engaged, had recently fallen into a spiral of emotional distress, marked by erratic behavior and deepening despair. Her mother, Pamela, a name withheld to protect her daughter's identity, described the situation as heartbreaking. When she called 911 earlier this year, police arrived but left her daughter shaken, often shouting, getting too close, or touching her unnecessarily, actions that left her feeling traumatized. This time, Pamela sought out the Crisis Assistance Response and Engagement CARE program, launched in 2021 to provide clinical support during mental health crises while reducing police involvement. A mental health professional, paramedic, and police officer responded, and the CARE team, trained to de-escalate tensions, managed to calm the situation. For Pamela, who has seen her daughter receive care support over 6 years, it's been a lifeline. If CARE hadn't come into our lives, I think these would have been much worse, she said. Yet, records show a troubling trend. Despite Mayor Brandon Johnson's 2023 pledge to phase out police from CARE, fewer mental health calls are being directed to CARE teams, and police still respond to most calls. The federal funding that sustains the program, which covers most of its operations, is set to expire next year, raising concerns about long-term viability. Johnson, however, insists on maintaining funding and expanding the program, framing it as a step toward a more humane system. The rise of mobile crisis teams, used increasingly after the 2020 George Floyd protests, has sparked debates about equitable access to care. Critics argue that while these teams offer alternatives to police, they lack the authority to resolve severe crises, leaving vulnerable individuals trapped in cycles of violence. Meanwhile, city officials claim that replacing closed mental health clinics with private partnerships will save millions, but opponents say it risks eroding community trust. The CARE program itself is a compromise, a 2-year pilot involving police, paramedics, and clinicians, though some resisted its inclusion. Now, with police removed from CARE teams, dispatchers must navigate a new landscape. In 2023, only 33% of CARE responses were initiated by 911 dispatchers, compared to 8% in 2021, a shift driven by fears of legal repercussions. Yet, when a crisis escalates, the CARE team's ability to intervene remains crucial. As the city braces for a restructuring, the challenge lies in balancing compassion with accountability. While the CARE program aims to reduce harm, its success depends on ensuring that no one is left behind. The question remains, can a system that prioritizes empathy truly deliver the care it promises? And will the fight for mental health reform ultimately redefine what it means to be a city that cares?